channel Nursing Medici. I hope all are doing well. So today I'm going to discuss about the charts which we have to be familiar before we are attending an aptitude test. So yesterday we discussed about the diagnostic test. You should be familiar. So the charts include, first one is the accumulative fluid balance chart. Can you read this? Accumulative fluid balance chart. That's a chart you should be familiar. That's a fluid balance chart, intake and output of fluid by the patient. So you should know how to fill all those forms and what all are the contents in that particular chart. You should be familiar with that. So I cannot show that chart in this video. Maybe it can become a copyright issue. That's why I'm not showing. But you can go to RCSI website in Google. You can just write in Google like RCSI Ireland Aptitude Test Preparation or Ireland Aptitude Test for Nurses. So like that, if you're Googling, you can get that page. And once you're opening that page, you can see all these charts in a PDF form. So once you're opening that website and opening each chart and go through that, I will just mention all the name of the chart which will be familiar for before attending the exam. Okay. The second one is a blood glucose recording sheet. That is the chart where we are recording the blood glucose level of the patient. The next one is a drug prescription and administration record. So that as a nurse, we should be familiar after giving the medication, what we have to record. So that will be different than India. So here we have another form will be there. So you have to be familiar with that form because in the practical exam, you have a patient, you will get a patient to give some medication. So once you are giving the medication, you may have to record it. That's why you should be familiar with that chart. Sometimes they will ask you to find an error in that chart. That means once we are giving the medication, we have to record that medication's name, frequency, and its dose, route, everything, and signature should be there. So if something is missing, that will be the error. So you may get a station like to find an error in the drug recording chart. That's why you'll be familiar with that chart. Then next one is a fluid balance chart. Again, another fluid balance chart. First, we just recorded the accumulative fluid balance chart. Here, the another fluid balance chart that also will be there in that website. You can go through that chart and familiar with that. Then Glasgow coma scale. So you know what is Glasgow coma scale, isn't it? We are checking the neuro observation for the patient. So the patient is getting any head injury. To know the level of consciousness of the patient, we are doing this Glasgow coma scale. So how we are recording the Glasgow coma scale. So when you are seeing that chart, you will get an idea how to record it. Then next is we have to know about sepsis form in patient adult. So sepsis forms means how the sepsis is occurring, sepsis infection is occurring in the patient and how we are recording the adult patient form. That also you have to read. So in that PDF, they have mentioned in detail what is that, what is a sepsis and which all are the things you have to be familiar, and the chart also there in that PDF. Then you have to know about ISBAR chart. You know what is ISBAR? ISBAR communication, isn't it? ISBAR means identify the patient. Then we have to know the background of the patient, assess the patient, and recording. So that's what, before we are doing any communication, we should follow the ISBAR communication tool. So I think I have done a video regarding ISBAR communication. I'm not sure if I didn't do, I will do a video of what is ISBAR communication. Then next is the IV fluid prescription chart. So once we administer the IV fluid, so we should have a chart to record that. So you should be familiar with that chart. The next one is a neurovascular assessment form. So that also for the patient who has head injury or any problem in the brain. Then next is a news chart or observation recording chart. Here the vital signs are known as a news, that is new early warning signs. That's what they are telling about the vital signs, the temperature, TPR, the same TPR and blood pressure, but we have another chart here. So you should be familiar with that news chart. Then another one is a SSKIN bundle chart. So that is nothing but it's a chart we are using for the pressure ulcers, the ulcer which form because of the pressure. So SSKIN means surface skin inspection, keep moving, incontinence and nutrition. That's what that SSKIN chart. So that also you should be familiar. Then next one is I think I have done video of pressure sore. So if you're going to the pressure sore, you will get an idea what is SSKIN, SSKIN. Next one is a waterlow pressure sore assessment. So that also another chart for assessing the waterlow level of the patient. So for waterlow, we have different components. So while we are assessing all these components, we will get a score for the patient, waterlow score. If waterlow score is high, that means the patient is prone to get pressure ulcer. So it should be below particular value. So that's why you should be familiar with that chart as well. So these all are the 12 charts you should be familiar before you are going for the aptitude test. I hope this video will be informative for you. If you like this video, please share with your friends. And if you're new to my channel, subscribe my channel and press the bell icon so that you will be notified with my new videos. So that's all for today. I'll come with another video. Bye-bye. See you.